Hi, I'm Tiffany Huth, Chief Communications Officer at the Innovation and Value Initiative. Joining me today are Emma Andelson and Corey Lewis from Six Cells. Welcome.
How y'all doing?
Thank you.
For having us.
Absolutely. So let's jump right in. This month is Minority Health Awareness Month. And I'd like to start the conversation off by getting your perspective and understanding on what does the word minority mean to you? And what does it mean to be from a minority community in healthcare?
Okay, well, I can start off. The word minority to me means I have less than you do. A lot of people seek healthcare and are disappointed or let down by the care that they receive. So, just for one, the lack of trust in the healthcare system has been the biggest issue in underrepresented communities. Considering the sickle cell community, I have sickle cell SC myself, um, and I just feel like there's still so much understanding that is still needed to just really deal with this complex disease.
Yeah. And I think to me, minority means being from, or in my case, advocating for a diverse experience that's not represented in the mainstream, whatever that environment is. Here we're talking about healthcare. And as someone new to the sickle cell community, for me, this has meant doing a lot of listening, a lot of understanding, seeing differences, and keeping empathy really at the center of the work that I'm doing.
And even, just coming from a minority in the healthcare as myself, just looking at previous medical situations with sickle cell, you have a lot of people not getting the best treatment. There's no improvement when it comes to mortality rates. And even still just being challenged with just the ER, me going to the ER and not always feeling like I'm being heard, or I'm always feeling like I'm putting pushed to the side. Um, all these issues have created a disconnect between sickle cell and the healthcare system. And to me, it means knowing that I can't expect care from every hospital, which I don't. I live in Atlanta, Georgia now, and I can only really go to two hospitals. So I just have to know specifically where I can get the best care. But everyone uses healthcare at some point in their lives, and I just really hope, in the future we won't really have to have the need for minority awareness, month, because healthcare is a human right, and we all should be treated equally.
Yeah, and we're here talking about sickle cell specifically, and we're just two voices sharing the experiences and the observations that we're talking about. But there's a lot of diversity in every single disease state, including within sickle cell, which is why the uniqueness is so important. So sickle cell primarily impacts Black and Brown communities, but there's a lot of individuality in it. So, like Corey said, our involvement in this month is working toward a future where quality healthcare is not unique to certain communities.
Exactly, exactly. So, are there any lessons learned or advice you can give other organizations to ensure that they have a seat at the table when these healthcare and healthcare research discussions are happening?
Sure. I feel like, I need to try to involve myself in more, we're getting more into the sickle cell community, but I also would like to see other organizations and just others putting effort into the sickle cell community to get involved, such as the Warriors, sickle cell patients, joining forces with other organizations to build a stronger voice, seeking education and opportunities to learn more about sickle cell treatments, and then having an open mind to new things. The medical industry is evolving, and you have technology evolving, and I just feel like this is the perfect time for us to really fuse our voice with it. The healthcare community is slowly getting better with building trust. However, there are still small factors that we just still have to take into consideration, from looking at the underrepresented communities. They may not have the proper access to healthcare. They may not have ever been to a doctor, or they may not have had a good experience with the doctor. But I just feel like all of that kind of hones into just not knowing. And that is a fearful emotion that no one wants to experience when they go to the hospital.
Right. And from the sort of research and healthcare system, or just non-community members getting involved, empathy is huge. Building bridges for underrepresented voices, making sure that they're included in conversations, because if they're not, if there's a lack of inclusion in healthcare research or things like value assessments, the solutions are not going to be appropriate for the community. Sickle cell is expensive. It's a very individual disease. And there's a lot of discrimination and stigma in this population or affecting this population that other disease states may not represent. So their models, their research, that's not going to be applicable to us. So I think it's really important that disease and population specific factors are considered when designing research or modeling care. And then lastly, making sure the funding is there. Really good and nuanced research is not possible without funding. And I think it's also critical that community-led research or just robust community involvement is funded in research to make sure that the solutions that are being proposed are going to work for the community.
Thank you for a great discussion today. For those of you interested in learning more about the great work that Emma, Corey, and their colleagues are doing at Six Cells, please visit their website at sixcells.org. Thank you.
Thanks so much.
Appreciate it.